Hi, my name is Jocelyn Diaz, and this is my population level health education intervention presentation. So, the four health issues identified for residents living at Canyon Country in zip code 91351 are alcohol use, access to healthcare, social determinants of health, and emergency preparedness. For alcohol use, in 2005, an estimated 22 million Americans struggled with drug or alcohol problem that has a major impact not only on the individual but the families and the communities as well. I noticed during my frequent drives and visits in the local groceries in Canyon Country, I noticed men purchasing alcohol early in the hours of early in the early hours of the day, on regular days. Um, it's not a weekend, it's not a holiday to warrant the occasional drinking and partying. So in an interview with one of the senior residents, she mentioned that she still loves to drink even with a past medical history of breast cancer and currently having hypertension and diabetes. So teaching them to limit alcohol intake became part of my education intervention for lifestyle modification on hypertension and diabetes education class. Access to healthcare. 16.31% in this community does not have health insurance. It is slightly higher compared to the whole California that has only 13.55%, according to U.S. Census Bureau of 2010. Accessing a location where needed healthcare services are provided is a problem. Although most of the senior residents have access to healthcare, going to see their doctor has become a problem as most of them don't drive anymore or somebody else and they rely on somebody else to take them to their doctor's appointment. Social determinants of health. This is lacking in the community as there are no parks or walking paths close by for the senior residents to walk or jog. Community center does not offer weekly activities such as yoga exercise class to promote physical activity, much needed by the senior residents as evidenced by their weight and presence of their chronic illnesses. 12.9% actually in this community lives in poverty. The senior residents, particularly where educational intervention class was done, live below poverty level. Emergency preparedness. Individuals and families do not seem prepared when a disaster strikes. There are a few households that have household emergency kits and supplies. Emergency supplies per person should last for 3 days, as suggested by County of Los Angeles Public Health in response to Healthy People Initiative of 2020. Background and significance. Nutrition, hypertension, and diabetes education intervention class, when provided, serve as primary prevention to promote health, as senior hunger and nutrition are significant issues in the U.S. with more than 10% of adults experiencing malnutrition, as stated by National Coalition on Aging 2018. Nutrition and hypertension and diabetes education class, when provided, serve as primary prevention to prevent the occurrence of heart disease, diabetes, and stroke to senior residents. The teaching class focused on hypertension and diabetes also serve as secondary prevention when residents were taught pre-diabetes and pre-hypertensive numerical values, as well as to recognize the signs and symptoms of these illnesses. I followed it also with explaining what the screening tests are, which includes A1C, fasting plasma glucose, and oral glucose tolerance test. CDC, in partnership with Health and Human Services, Administration for Community Living Agency for Healthcare Research and Quality, and Centers for Medicare and Medicaid Services, jointly released a report in March 2011 to underscore fundamental gaps for adults age 65 and older who are not receiving fundamental services such as diabetes, obesity, and blood pressure screenings, and highlights the need to link community and clinical strategies that focus on the underserved. I got this from CDC website 2016. Healthy People 2020 objectives for nutrition or healthy eating are: increase the proportion of adults who are at a healthy weight, reduce the proportion of adults who are obese, reduce household food insecurity, and in doing so, reduce hunger, reduce consumption of calories from solid fats and other sugars. Healthy People 2020 objectives for hypertension and stroke are: increase overall cardiovascular health in the US population, reduce coronary heart disease deaths, reduce stroke deaths, reduce the proportion of persons in the population with hypertension, increase the proportion of adults who have been advised by a healthcare provider regarding cholesterol lowering management, including lifestyle changes, and if indicated, medication. Healthy People 2020 objectives for diabetes are: reduce the rate of all-cause of mortality among persons with diabetes, reduce the rate of cardiovascular disease deaths in persons with diagnosed diabetes, improve glycemic control among persons with diabetes, and lastly, increase prevention behaviors in persons at high risk for diabetes with pre-diabetes. So all of these 2020 objectives were addressed when I did my education intervention for nutrition, healthy eating, and hypertension and diabetes management. Needs assessment. Needs assessment were done for Canyon Country Senior Apartment residents, were done through observation and interview. I used observation, and I noticed that senior residents passing by the lobby when I was there asking for permission from the manager of the facility, and also being in the parking lot several times that I was there, I noticed that mostly the senior residents are obese and overweight. I also did interview, and I did briefly talk to a couple of senior residents. Two of them are Mary and Dennis. Mary, and I quote, I have diabetes and hypertension. I would love to know more about it because when I go to my doctor, he doesn't tell me anything. I also asked Dennis, who is a senior resident at the facility, who stated, "Oh, I have 10 blood pressure medications." So the primary problem for people living in this community is lack of effective programs that address the unique needs of the family, such as poor nutrition, health promotion, and wellness, leading to increased risk of having hypertension, diabetes, or exacerbation of these illnesses for those that were already diagnosed. So with the interview and with the observation, I focus on the nutrition, healthy eating, and hypertension and diabetes management for my education intervention. Theoretical framework model that was used was by Oren's self-care theory. One of the major assumptions of this theory is that people should be self-reliant and responsible for their own care and others in their family needing care. The seniors residing in their own apartments are responsible for their own care. They are living on their own without their grown children supervising their health or managing their health. Living by themselves means that they responsible for their own nutrition and diet, from grocery shopping to cooking their own meals. They are also responsible for keeping their doctor's appointments and taking their medications for management of their chronic illnesses. Another assumption of Oren's self-care theory is that person's knowledge of potential health problem is necessary for promoting healthcare self-care behaviors. This is taken from Current Nursing of 2012. So if the seniors are made aware of the possible consequences of negative possible consequences of not managing their chronic illnesses, then they will be inspired to initiate and perform on their own behavior to be healthy. So it was emphasized to them the importance of maintaining their health, following a nutritious diet, healthy eating, so that they can be physically active and maintain their independence. Information were given and provided, and encouragement so that they can make lifestyle changes to keep their weight under control, prevent hypertension and diabetes, or lower their blood pressure and keep their diabetes under control through, again, nutritious, healthy eating and engaging in moderate physical activity as much as they can tolerate. Issues, barriers would be they have inadequate knowledge and again, cost. As we said earlier, most of this senior residents live in below poverty level. Assets would be availability of free services. So for nutrition, in older people, collective determinants of healthy eating, such as accessible food labels, an appropriate food shopping environment, the marketing of the healthy eating message, adequate social support, and provision of effective community-based meal delivery services all have the potential to mediate dietary habits and thus foster healthy eating, according to Pyatt and Schattenstein in 2005. So actually, for food labels, they are now more consumer friendly and they are revised. Part of my teaching education is to teach the senior residents how to read food labels and what nutrients they need to include on their diet and what nutrients they need to eat less of. Hypertension, diabetes, access to healthcare would make it easier for them to work with their healthcare providers and make some lifestyle changes when they know what they need to do, why they need to do it, and how they're going to do it. Intervention for nutrition. By emphasizing to them the benefits of healthy eating and understanding why they need to engage in nutrition or healthy eating, they're one step closer to achieving a healthy weight, reducing household food insecurity, and in doing so, reducing hunger through SNAP, which is Supplementary Nutrition Assistance Program. This is provided for those that are if you qualify, if you're low income, they can give financial or cash assistance when you do your groceries, when you buy your fruits, vegetables, and grains. And reducing consumption of calories from solid fats and other sugars when thought what nutrients and food they should have in their diet and what to avoid, in turn meets the objectives of Nutrition of Healthy People 2020. For hypertension, same thing. If we emphasize the importance of working with their healthcare provider and making some life changes, overall cardiovascular health in the U.S. population will increase. Coronary heart disease and stroke death will be reduced. Proportions of persons in the population with hypertension will be reduced, meeting the objectives for hypertension in Healthy People 2020. As for diabetes, by emphasizing the importance of working with their healthcare provider, making some lifestyle changes, the rate of cardiovascular disease deaths in persons with diagnosed diabetes will be reduced, glycemic control among persons with diabetes will improve, prevention behavior in persons at high risk for diabetes with pre-diabetes will increase. Pamphlets and trifold board were used as educational materials. Pamphlets highlighting major ideas are created using simple terms written in bolded big fonts because increasing age has an adverse effect on various human capabilities, including visual and auditory perception, as stated by Lockhart and Shee in 2006. Having that in mind, the trifold poster board was placed right in front of the learners. The pace was lower and speech was louder and clear. Teaching voice, yes, was louder because hearing loss is common among older adults, as stated by Mauck in 2006. Opportunities for discussion to cover major points were provided. Questions were encouraged to ensure the learners understood the materials. They were taught what nutrients they need, what nutrients they need to avoid, what a healthy plate consists of, how to read food nutrient labels, signs and symptoms of hypoglycemia, hyperglycemia, diabetes ketoacidosis, prediabetes, stroke, and screening tests, as well as blood pressure ranges, blood sugar levels, and ways to keep diabetes and hypertension under control. Project eval and outcome measurement. Overall goal and objective is to increase senior residents' knowledge on healthy eating, hypertension, and diabetes prevention and control. And in doing so, it reduces obesity, improve cardiovascular health, improve glycemic controls, and decrease the number of deaths from coronary artery disease, stroke, and diabetes. Evaluation of short-term goals. So by the end of the class, participants were able to verbalize to me what five food groups needed to be on their plate and what nutrients they need to eat more and what to eat less. By the end of the class, participants verbalized what a normal blood pressure and blood sugar level is and stated 3 ways to prevent or maintain hypertension and diabetes under control. So for evaluation of long-term goals, it can be evaluated with the number of Kenyan country senior apartment residents' consumption of low-fat, low-sodium, less sugar food intake increased, and the number of senior residents with uncontrolled hypertension and diabetes decreased. Budget. The organization of the community is willing to bear the cost. The organization needs data though, like they need large number of senior residents requesting for health promotion and wellness classes and activity programs, and also a large number of residents actually participating. Location is free. The community room or location of the event is property owned, complete with tables and chair. For materials, one-time purchase of dry erase whiteboard, approximately the size of 60 by 40 inches, would cost about $175. Flyers and handouts would cost $20, and the salary for a 1-hour class for education intervention would be $60. Results and conclusions. Healthy eating and exercise do not seem to be a priority for the residents in Kenyan country. There are no parks, walking pathways, and physical activity programs available for the Kenyan country senior residents, and as a consequence, many senior residents are obese, have hypertension or diabetes. Therefore, educational intervention was focused on healthy eating, hypertension, and diabetes prevention and management. Weakness. Poster board use could have been made colorful so that posted notes would have stand out. Suggestion. Flyers need to be posted on each resident's door to encourage and remind seniors of the upcoming classes. These are my flyers for nutrition, my hypertension diabetes flyer, my nutrition pamphlet, hypertension diabetes pamphlet, poster boards that I use. These are my references. Thank you.